Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Hello and welcome to another edition of Senior Care Confidential. Today, I am absent Joe. She is actually visiting grandkids for the month of July. And so I decided to have one of my new friends and colleagues on, Marina Lackmanchuk. And she is a lymphedema specialist, fellowship trained therapist. And because in this marketplace, we do see a lot of lymphedema cases. We actually utilize your therapist for these cases as well. And so I felt like this would be a really unique opportunity to have you on to kind of discuss like what in the world is lymphedema. It looks like we're seeing a lot more of these diagnoses here recently than in previous years. And it's really kind of hard to find really good qualified trained therapists / nurses who actually can do this stuff. So welcome to the show, Marina.
Thank you so much for having me.
Thank you for coming. Yeah. So let's start a little bit of background with you first. Like, how did you get into this field? Because it's not something we were talking before the show. This is not something that most therapists go, oh my gosh, you know what? I want to deal with weepy wounds all day long. And so how did you get into lymphedema?
You know, I really found myself in lymphedema from the wound care space.
Okay.
I loved wounds. I got out of school. I went to Big Baylor as my first job and was doing a ton of wound care there. And what I quickly picked up was wound care has to have compression.
Yeah.
And wounds heal through being compressed. And there isn't any other better compression systems than when you're dealing with lymphatic patients.
Can you explain why wounds work better with compression?
So it helps the skin kind of come together as the fluid sits. As they have these wounds, you know, your body creates white blood cells and those white blood cells go in and fight that infection and heal that wound.
Yeah.
And so when you're dealing with that, you're getting an increased amount of fluid that is stretching that skin actually further apart, causing
doing the opposite of what we needed to do.
Exactly.
I gotcha. Okay.
So when you compress that back together, it helps push those skin to close up those wounds.
Okay.
And so I found myself in the midst of COVID, and I had been doing lymphedema for this entire time. I was not certified, but I had a great mentor at Baylor, Dallas, and she taught me lymphedema, and I was doing lymphedema. And during COVID, someone asked me, you know, are you certified? And I said, no, I'll go get certified. And so I went and got certified, and I fell in love with it. And then I started certifying all of my therapists, and I was handing them out like Oprah Winfrey. You want a certification? You want a certification?
Awesome.
And,
awesome.
you know, people were really also wanting to do something because, you know, with COVID, physical therapy, you know, people weren't letting people in the house. And what we found is wound care, that was not...
It's non-negotiable.
It's a non-negotiable,
yeah.
You know, and so people wanted to heal their wounds. And so we found through wound care, lymphedema, and I fell in love with lymphedema.
Interesting. Okay. So for the audience,
Yeah.
how would you define, like in layman's terms, how would we define lymphedema? Like what causes it? What are the risk factors we need to look out for? That kind of stuff.
Yeah. So, you know, lymphedema, before we talk about what lymphedema is,
Yeah.
I kind of want to talk a little bit about the lymphatic system.
Okay. Perfect.
Because the lymphatic system, a lot of people, everyone knows what the heart does. Everyone knows what the lungs does. Nobody knows what the lymphatic system does. And so it really works closely with the heart, with your arteries and your veins. And so what the lymphatic system is responsible for is getting rid of excess fluid from your body through excretion from the kidneys.
Okay.
And so
it sends the excess fluid to the kidneys, which then expels it through urine. Is that
yes,
correct? Okay.
Absolutely. And so that happens through, as the oxygenated blood goes through the arteries and the veins, it dumps out these proteins, wastes, blood particles, CO2, and your lymphatic system kind of picks those up and moves them to the lymph nodes through vessels and lymph nodes. And I like to call it the DART buses and the DART stations. And so your lymphatic system is the DART routes, picking up through the buses, and it moves it into the lymphatic nodes, which are the DART stations, moving it into the kidneys.
Got it. Okay.
So,
and so lymphedema is any dysfunction that occurs within that system that creates this swelling of usually extremities.
Absolutely.
Okay.
So when it's not working properly, and there's various reasons of why it's not, when it's not working properly, then we notice we have something called lymphedema.
Okay.
So you will see swelling most likely in the legs and the arms. But as we talked earlier, sometimes we see patients that have it in the face, in the neck, in the groin, and in the abdomen.
Yeah.
So
I think I was telling you, my very first patient with lymphedema was one in the groin, and I was like, "This is not a world for me." So I'm so grateful for therapists like you, where you guys are willing to do this kind of stuff.
And you have to imagine how uncomfortable they are.
Oh, totally. Yes.
I mean,
yeah, you're walking around like this. You know, it's bad.
It's bad. And so we talk about causes of lymphedema. The one that I feel like everyone knows is cancer. Breast cancer, prostate cancer. Those are next to lymphatic systems. So we usually tend to see oncologists remove lymph nodes near those areas.
So help me understand that.
Yeah.
So the lymph node system is part of the immune system, right? The whole lymphatic system, part of the immune system.
It is.
Or it's correlated with.
It's correlated with the immune system.
Why remove the lymph nodes with cancer treatments?
I think that because lymph nodes it's a circulatory closed system. So if cancer is next to that area, it causes the spreading. So they'll remove any lymph nodes that are close to that.
Got it. And so
then
spots. Back to your dart rail analogy, if we're removing some of the nodes, that means we're removing some of the rail system back to the kidneys to flush out or excrete out the fluid. And
what you'll see, especially with the cancer patients, is they won't get lymphedema automatically. It happens in a much later stage.
Okay.
And so I want to get a chance to talk about staging, because they'll put cancer patients automatically in a stage 0. They'll always be very susceptible to lymphedema. They may not always get it, but they will always be susceptible.
Okay.
You asked me earlier, why remove some of the lymph nodes? I think a lot of it is education.
Okay.
I think 15 years ago, 20 years ago, patients would tell me they removed all the lymphatics. They didn't really know what it did and how it helped, and that it was tied to the immune system and, the aftermath of lymphedema itself. And so physicians were just like, let's just remove them. If it was a benign tumor, they would just go in and remove all the lymph nodes.
Just to be safe, on the safe side.
Just to be on the safe side. And then later on,
we just get smarter over time. Yeah.
Absolutely. It's evolution. So, but that's where you will see lymphatics with surgical approaches. They'll just go in and remove.
What are you probably have some statistics for like the United States, but what are or in the Dallas area, how many people are affected by lymphedema? Because it seems like a lot more these days than it was before.
Worldwide, it's 250 million.
Holy smokes.
Yeah.
It's a lot.
Yeah. 10 million in the US, and that's in counting. I think I'd love to see, because the Lymphedema Treatment Act just passed, I'd like to see what the numbers are going to come in at the end of 2024.
Because is it going to be dropping about insurance and reimbursement? Is that why you say that? Because you'll find that it will be more likely to be diagnosed.
I think that just the buzzword of lymphedema, like doctors are more like, what is that? Before the approach of Lasix.
Yeah.
Now there's like, oh, what's lymphedema? Let's look into that. Oh, and people see a picture of it and they're automatically like, oh yeah, that's my patient's leg.
Yes.
And
we see it regularly.
Yeah.
All the time.
We see this all the time. Yeah. And so they'll refer more, where before it wasn't even a recognized diagnosis.
They just thought it was dependent swelling.
Right. They would call it edema.
Yeah.
You see edema all the time.
Is there a distinguishing feature between lymphedema and edema?
You will see, especially with lipedema, you'll see that feet characteristics of the small feet and the big legs.
Yeah.
But with lymphedema, you will see just it's the shape of the leg. It becomes like a log limb.
Yeah.
So
back to we were talking about how the lymphatic system is associated with the immune system. So if we go so I'm an orthopedic trained, because I don't want to touch wounds.
Yeah.
I'm an orthopedic trained therapist. And so who now does geriatric, but if you look at just a traditional injury, the body heals injuries kind of almost like it does infections, right? So you get arthrogenic muscle inhibition. So let's take, for example, an elbow. I sprain my elbow lifting weights or mowing on the lawn or whatever. And so I'll get some muscle inhibition around the elbow so that I don't overuse it, right? I'll make it seem weaker so I can't use it, right? I'll get usually some muscle guarding, which restricts the motion, right? Depending on how painful it is. And then I get obviously the pain stimulus, but I also get swelling, because swelling is the body's natural way of sending white blood cells and some other things to help you heal.
Yeah.
So that's like the normal edema. There would be swelling around whatever impacted joint that the body's trying to heal,
Sure.
which is normal, by the way. Did you know this? So we were talking about I told you, at least rapid control. The whole RICE principle. Remember studying that in school? RICE?
Yes.
Rest, ice, compression, elevation.
Absolutely.
So it was like the gold standard for a long time. Do you know that the doctor who created that, I think it was like I'm going to misquote this. It was 30, 40, 50 years ago. This doctor who came up with the RICE principle, like 5 years ago, came out and recanted it.
No.
Yeah. So we taught this for years, which is awesome. I love the fact that the guy who actually did it said, you know what, under further review, if we are impacting the body's ability to have an immune response, which is how it's supposed to, like to fix an injury, then we're probably delaying healing. That was a whole aside. But anyway, so that would be like normal edema. So lymphedema is specific to, it's impacting the actual dart rail system, the vessels themselves, the nodes themselves. That would be the distinguishing feature between those two?
Yes.
Am I getting that right?
You will usually see it through like an ultrasound. If the veins and arteries are not leaky, then they automatically say that is lymphedema itself.
Got it. Okay. And you mentioned before there's stages of this. What are the stages?
So you'll have a stage 0, and only oncology recognizes stage 0. So these patients are automatically going to be in
and that's only because we already know at some point in the at some point in the future, you will be much more susceptible to having lymphedema. So why don't we just put it on your chart that you're stage 0, so we watch for it.
Yeah.
Got it. Okay.
But stage 1, these are going to be our like under the radar folks.
Okay.
These individuals come home from a long day of work where they did a lot of standing that day, and they will just have this light swelling. And they wake up in the morning and it's gone.
Yep.
And that's your stage 1.
Yeah.
Or they will do some kind of activity, and that activity causes them to be more swollen for a short period of time. Could be a couple days, and then it'll subside.
Okay.
So then you have stage 2. Stage 2, there is an obvious difference. They'll remain puffy, and they're lightly puffy. Stage 3 is where I see patients getting more anxious about it, because this is where you're introducing skin changes. The skin stops feeling as soft. It begins hardening. It almost starts to create an alligator skin texture to it. You will see possible more wounds with this.
And you were mentioning the reason the reason behind the skin changes is because as the fluid comes up towards the surface, it starts to crystallize, and that's what's changing the aesthetics, I guess, and even the feel of the skin tissue. That
long term of that fluid sitting there, and your patients, you'll see they'll have almost like a purpling in their lower extremity, and that's called hemosiderin staining. And that's just because as that lymph fluid is dumping in the lower extremity, that also has blood particles, and those blood particles sitting there for long periods of time end up staining the tissue. So as they get more compression, it actually becomes more purple and more evident. It'll be light pink when they're very, very swollen, but as you remove that fluid in that interstitial space, then
I gotcha.
It looks more purple. And so the patients will be like, oh my gosh,
it's looking worse.
Bruise. Yeah. And I have to do the education of it's not a bruise, it's hemosiderin staining from those blood particles sitting there for a long period of time.
Got it.
Yeah.
Okay. And then, so that was 3, right? Where you start to see some potential wounds. Yeah. Okay.
And then everyone knows the scary elephantitis.
Yes.
Where, their limbs become almost the size of this table.
Yeah.
And that is the end stage of lymphedema. And that's where, our patients are really struggling with functional mobility, independence with life.
We see it even earlier. Like if we go with your stages, and I'm learning this for the first time. So like stage 3, even at stage 3, and some, depending on how bad the stage 2 would be.
Yeah.
When you've got all that excess fluid sitting around the ankles, right? There's your nerve endings that are providing information, like sensory information to the brain.
Yeah.
They're kind of superficial. And so they become impacted by that fluid sitting there. And so you'll have patients who have a lot of swelling in their feet that will say they can't feel the floor as much.
Yeah.
They don't have the we would call like the neuromuscular ability to sense small changes so that the muscles know which way to fire to keep them upright. So we see even like balance changes even
100%.
earlier on with those swelling. And so that would be like in stage 2 and 3. But you were mentioning before the show there, if you get too far down those stages, it's no longer reversible, but there are stages where it is reversible.
So stage 1 is where it's reversible.
Okay.
But in that stage, I feel like a lot of us are much, yeah, exactly. You know,
Right.
like I'll deal with this tomorrow. And that's the time where it's really important for you to get in there and address it.
Yeah.
But, you know, our doctors are sometimes not as educated on catching it at that stage 1. And they're kind of like, oh, that's just a little bit of swelling. Just elevate your feet and kind of move on.
Yes.
So, you know, sometimes as the patient, you have to kind of be that advocate for yourself and say, hey, I would love to get this checked out and ask about it, because that's the time where you can get more compression socks and find ways to, you know, put it into a maintenance stage. That's the time where you can just jump in and move it into a maintenance stage, versus when you're at that stage 2 and stage 3, then you're running into the issue where you need to decongest those limbs.
I gotcha. Yeah, I know you do a ton of education, not only for patients and families, but also for therapists and for physicians. What are some of the, I don't know if I would say misnomers, but what are some of the things, like common themes that you see as you're educating? Like, oh my gosh, I did not realize that, or I didn't know that. Are there things that you see where there are common questions that they have for you? Or is it just you're enlightening them to a whole other world of, hey, it's not just dependent swelling. There's actually other things going on?
Yeah. So, you know, some of my patients, their frustration with, and, you know, I don't think they mean to take it out on me, but they're like, how come nobody's talking about this?
There you go. That's where I'm going. Yes. Yeah.
How come you're the first person to tell me, and I've had this swelling for 20 years? How come I've been sitting on Lasix for 20 years and been telling my physician, I don't think it's helping, so we're going up in milligrams, and now I may be entering renal failure? And they're frustrated at the process because now we're at a stage 3, stage 4. They've gone to see vascular, and vascular is the one that we tend to see refer the most, if not oncology. So we see
oncology makes sense because the nodes,
the oncology, I would say extremely educated, vascular is educated, and wound care. They will also, you know, catch it. But a lot of times they're not seeing those individuals because we may not be catching something, and they're sticking with their primary. And primaries, you know, I try to get out there and educate as much as possible for them.
They have to see a lot of stuff.
They see a lot of stuff.
It's impossible to be an expert in everything.
Which is why they're called primaries.
That's right. Yeah. Wow. So I don't want to skip over that one piece. You had mentioned that for years, one of the maybe I shouldn't say primary, but one of the more common ways to treat lymphedema was Lasix, because I see this in our practice too. And if that dosage didn't work, then we're upping that. And you mentioned, as you're relaying that story to me, that it also can relate to or can cause kidney failure.
Sure.
From long-term use of Lasix. And so I want to make sure we're real clear on this. Like the previous ways, or one of the more common ways to treat this, was Lasix, that can lead to long-term kidney issues, like kidney failure, because we weren't treating it the more proper way? You know, I think... Or am I being too cruel on that?
In that case, I think, you know, the physicians had the best... 10 years ago, 10 years ago, there might have been 3 lymphedema therapists in Dallas.
Right, that's right. Yeah.
Like, the education and the availability of lymphedema therapy has just really increased in the last 5 years.
Yeah.
So I will tell you, I had 5 years ago, maybe 10 patients for our entire census.
Mm-hmm.
Now it is 250, 300. Yeah. So like you are talking about a very large difference.
It's an education. So I'm not trying to knock them.
Yeah.
But for patients who are or family members who are like, you know, mom's got swelling and we're kind of doing the Lasix thing. It may or may not be working. My point is there might be something else we should look at.
Exactly. Yeah. So there's a portion of that. There's also a portion of the way that the patients are choosing to use their Lasix. So the point of the Lasix is to urinate.
Yes.
And improve kidney function. But the problem is that the patients are like, I hate going to go pee every 5 minutes.
Yes.
It's hard for me to get up. So I'll take this Lasix pill, but I won't drink any water.
That's correct.
And so I stopped drinking water at 3 p.m. Well, with that Lasix medication, all it's doing is burning the kidneys because there's nothing to flush it with.
Yes.
It's like an engine.
And you also get, because we see this all the time, right? The same reason, right? Yeah. I don't want to drink any more water because I can't get up to go to the bathroom. And by the time they're seeing me, usually there's other things happening, right? It's harder to get up and move around. And so they're like, I'm exhausted, or I'm a fall risk. I just don't want to, I don't have to, or it's aggravating. Right. So now these poor women, usually women in this case, they stop taking their Lasix so they don't have to go to the bathroom. So they stop drinking water in addition to their Lasix, and they become dehydrated, which leads to blood pressure issues, 100%. Which also leads to urinary tract infection issues. And so there's all these things.
Yes. Ding, ding, ding.
Right. All of the above, because I didn't want to drink water because I was going to go to the bathroom.
Right.
Right. Because I'm on, and Lasix just makes that process faster. I have to go more frequently when we do that.
Yeah.
Versus just seeing you and dealing with lymphedema.
Yeah, exactly. It's just, it's
so
a
what are
cycle.
We kind of went through the stages. What are some, and this may be even a poor question, just in terms of treatment strategies for lymphedema, like you're going to go out there and see a patient, and what are some of the common ways? Like, I know maintenance is probably different, and so we can talk about this in a second, because a lot of times the physicians are recommending things for their patients that are actually more geared towards maintenance, like after you've actually taken care of the issue. Mm-hmm. So can we address that? Like, what are some of the common treatments you see to get it under control, so that now we can kind of do what the doctor was talking about, which is more of the maintenance side?
Absolutely. So a lot of the challenges that we see with patients is it's an involved process. Mm-hmm. I think physical therapy in itself is a very involved process. It takes a lot of the patient having to do these things. And so when we come in, we really change, their lives in a sense from how much they need to participate in this process. Mm-hmm. We put them through decongestive exercises. We put them through manual lymph drainage, but we also put them through a decongestive wrapping system. Okay. And this is very difficult for the patients because they can be wrapped anywhere between right above the toes all the way up to the thigh. And they wear these wraps for 3 days at a time, sometimes 2 days at a time, for months, in order to kind of decrease that fluid without overloading the heart.
Sure.
And this changes kind of their quality of life, and you're giving them all this information. They have to really lean into this process because, we've seen patients that are,
No, you're good.
What I'm looking for. Compliant.
Yeah.
We've seen 30 centimeters in change in 8 weeks.
Holy smokes.
That's a game changer for them. But what they have to put in is that they have to be willing to wear these compression system for, 8, 16 weeks at a time. And that's
these are
tough.
custom made to them, correct?
These are the wraps.
Okay.
So we put them in a short stretch bandage wrap system.
Okay.
Now, there are garments and there are rehabilitative garments.
Okay.
Just now with the Lymphedema Treatment Act that passed in January, those are now covered if they have specific insurances. But for those that don't have those specific insurance, they can be pretty pricey.
Yeah. So we were talking about this before the show too. This is another one of these things where had I known better, I would have made a different choice. And so I know, because you and I both work with a similar patient demographic, that there are insurances, like a lot of Medicare Advantage plans, who do not. Is it that they don't even recognize lymphedema as an issue, or they won't recognize the treatment strategy or the
they
treatment
won't
plan?
recognize the treatment strategy.
Okay.
I find the Advantage plans just are.
It's just dependent swelling. That's all this is. Yeah.
HMOs, 100%. It's a no.
Yeah.
It's they call it experimental.
Yeah, which is wild because it's been around for years.
Yeah, and I'm. I don't think I can say that.
Feel free. We can always cut it.
There are some individuals pretty high up in some of these insurance companies that are now having lymphedema, and it's
now we're starting to realize
we're seeing some possible movement because
there we go.
When you tell someone, when you tell someone your lymphedema is experimental, that's a game changer for them.
That's right.
And
but traditional Medicare still recognizes it.
Traditional Medicare not only recognizes it, they will put you in garments, brand new garments every 6 months.
Wow.
The therapy and your ability to get therapy in the home setting is much more
for sure.
Than any.
Yeah. And they cover and the wraps are not cheap.
They're not, but they're reusable.
Yeah.
So the wraps can be anywhere between $300 to $400, just depending on the entire system. But that's one system stays with them for 16 weeks up to 24 weeks, depending on the complexity of the patient. And so the patients can wash them. It's great. And then we put them in a garment. And if they have traditional Medicare, that garment gets paid for, especially if they have a supplement. So it's the 80-20.
Sure. Yeah, the DMA thing.
Yeah.
Okay.
And so
you guys are using garments and or wraps to manage not to manage, because the manage is more maintenance, to help them on the initial stages of the treatment. Okay, of the decongestion. That's what you guys call it. Okay. And then once you're to a certain level of decongestion or improvement, then we go more to maintenance. And what does maintenance look like?
And maintenance is the garment as far as if it's a sock, if they're in stage 1. But the problem is my stage 4s want to get into a sock, and that is not. I'm not sure if you've ever put these socks on these patients, but you are busted a sweat.
I have put them on myself, and I'm pretty lean, and I'm like, wow, how does anybody?
Sweating. Yeah.
Yes. Yeah.
Those are meant for stage 1s. Those are not meant for stage 4s, but they're.
And I would argue if you have any muscle mass or whatever, those are pretty hard to put on too. Like there
is tips and tricks, but they're not made to hold that much fluid. So some of our advanced stages, we like to put them in like a Velcro piece where they can put it on themselves.
Yeah.
A family member can put it on without, because that helps compliance. If a family member is breaking their backs trying to put in these garments, chances of them staying compliant are going to be pretty rare.
Yeah.
So
I have this discussion with family members and patients all the time. There's, I think it's Thomas Sowell who has that quote, there are no solutions in life. There's only trade-offs.
Yeah.
And so
you get what you pay for.
If we opt for like the ideal wrap or the ideal sock or whatever, and because it's too hard to take on and off, you won't use it, then what good is it?
Yeah.
And so we might want to go with something that's got a Velcro or a zipper piece or whatever, even though it's not necessarily the best option. In this case, it might be the best option because you'll actually use it.
Yeah, 100%.
Yeah.
And then they get put in pumps.
The pneumatic pumps, like the automatic things? Yeah. Okay. Those are the ones you see like in the gyms?
They are
kind of
they are
the bougie gyms.
The bougie gyms. Except this has like 8 chambers, and so they like blow it up in a way that kind of looks as if we were to be doing that manual drainage.
Got it. Yeah. Okay. What's a typical somebody contacts you because their mother has lymphedema issues? Are you usually seeing them a couple of times a week? Are you seeing them daily? Are you seeing them? What's the frequency usually look like? So
in home health, and I would say the same in outpatient, you're looking at twice a week.
Okay. For several weeks or for a few months? Obviously a stage 4 is very different from a stage 2 or 3.
Yeah. So it really depends on their stages. It depends on their comorbidities. It depends on just where they're at. You know, I try to meet patients where they're at in this process, because you're the first person telling them this and they're like, I am not ready to kind of handle this. So we might have to start out with a 4 wrap system versus the 6 traditional one that we do. So that way they feel a little bit more comfortable that they're not just being put in like a sausage casing and or if they have, if they have claustrophobia or something like that.
Oh, totally. So I have claustrophobia. I can't imagine being in something for days and days.
Yeah. I mean, just the anxiety of it. So we try to meet them where they're at and try to be as successful with it as possible, because I say something is better than nothing.
Yep.
And so with those patients, we tend to see them for anywhere between 16 weeks is where I try to get out if it's a standard patient.
Yeah.
16 weeks is the max.
Kind of the goal to get them where they're maintaining.
Yeah, that's the gold standard for me.
Okay,
But I've seen patients decongest in 8. And if the younger ones, if they can decongest in 8 and we can move them into me, let's do it.
Okay.
Yeah,
Last couple questions. Medical complications. So we talked earlier about, because the downside of us, there's wonderful things about having specialists. I love having specialists. I went to go see a back specialist, and because I wanted the guy who doesn't do the ankles and knees working on my back. Yeah. Right. So there's great things about a specialist. The downside of a specialist is everything gets so focused on one system that we forget. We just kind of neglect the fact that all these body systems are working together.
Absolutely.
And so with lymphedema cases, like there are going to be some issues with kidneys and with the heart. So are there contraindications for some patients based on whatever medical complications they're dealing with or comorbidities? Are there complications or are there limitations to what you guys can do depending on what the other medical diagnoses they're dealing with are.
Yeah, absolutely. So, if they are having uncontrollable blood pressure, we don't want to move more fluid towards the heart.
Correct.
That will overload it.
Okay.
So anytime that they're kind of like an AFib or their congestive heart failure is kind of not getting out of control and there needs to be some medical management first, those things hinder us from doing our jobs.
Because the decongestion process of getting things out of the limb, does it ultimately go up. To filter through the heart?
It's got to go.
And so we can overload the heart. So if we're already having issues at the heart level.
Yeah, because the blood is pumping to that area. And especially if they're an AFib and, it's 145 beats per minute, now we're just adding more. The heart has to work more vigorously.
So this is where working with people who've got a lot of experience in training and kind of know, we need to have other specialists involved in this case too.
100%.
And then last question, we mentioned before that the immune system is closely correlated to the lymphatic system.
Yes.
And so when you have patients with lymphedema, this goes to if we're not spotting things like the canary in the coal mine thing, if we're not starting to identify things early before it becomes a major issue, like before you start having the gaping holes in your leg, if you catch it earlier, there is a correlation with lymphedema and a weakened immune system, correct?
Oh yeah, 100%. These patients will definitely have they're more susceptible to infections. And they will see if they have an infection anywhere near the body, they're going to see the swelling in whatever limb is affected. And it may not have anything to do with that limb, but there's an infection happening somewhere. Those white blood cells are sending fluid out there. The body is reacting with histamine. You know what I mean? So we are seeing that. If it's not something that we're doing, if we are wrapping the way we've always been wrapping and the leg is just overflowing, we know that there's a systemic infection somewhere.
Interesting.
These patients are tending to see infectious disease more often. They get cellulitis. Any patient that has lymphedema will tell you, oh yeah, I get cellulitis all the time.
Yeah.
And it's terrible. It causes hospitalizations over and reoccurrent.
So if they manage, once they work with y'all, or another lymphedema therapist, once you got it to where is it decongested?
Yeah.
Okay. Once it's decongested, I can talk like a lymphedema therapist now. Once it's decongested, does their immune system strength return or improve? So I guess my point is the immune system effect only weakened when lymphedema is actually present, like in the larger stages? Does it improve if you get it decongested?
So the way that I think about it is when you eat well, like when you're eating healthy, your body feels better. It's the same thing with the lymphatic system. You have to think lymph is waste, and waste throughout the body wears the body down.
Makes sense. Okay.
So when they have a ton of lymph fluid sitting in their body, they feel not great.
Yeah.
And so that immune system, once my patients will tell me once they get manual lymph drainage, they'll feel so much better. They feel lighter. And they'll tell me they immediately go to the bathroom.
Okay.
And I'm always like,
so I was going to add one more question to that.
Yeah.
Because there are sometimes when you go get like a really good massage, you can actually feel sick.
Sure.
Because they've made some things move. Like there's some toxins that get released or whatever.
Yeah.
The first couple treatments for someone getting lymphedema and the manual drainage, do they have experiences like that as well? Because you're actually freeing some of that waste product up? Or is it just they go to the bathroom more? They
go to the bathroom more, but some of those are deep tissue massages. And so my patients will tell me, I got a deep tissue massage and I feel better. Sometimes it's still moving lymph fluid, but manual lymph drainage, lymph fluid sits just below the skin. Okay. It's right above the muscles, but just below the skin in that we call it interstitial space. And so manual lymph drainage is a light skin stretch. I mean, it is light. So I'll come to the patient's house and they'll be like, I was told I was going to get a massage, and I start and they're just looking at me like, what is this? Right. This is not what I signed up. This is not what I signed up for. And so I have to tell them that anything deeper than that can move that fluid into the deep tissues, crystallizing and moving it into the skin changes. So we have to be careful. Where I tend to see my patients have that reaction is when we do the abdominal exercises and we're moving some of that fluid in the abdomen. My patients will have that, can have that reaction.
Kind of a sickness reaction.
I always tell my therapist in that area, you got to be really careful how deep you press.
Yeah. And prep them. Hey, you may have.
And you may have, this may make you feel nauseous and all that. So
this is really good. I so appreciate you coming over and doing this with us.
Thank you so much for having me.
So if someone has questions for you, how would they contact you?
Yeah. So our company is called Ultra Therapy Solutions. We are local to Dallas. You can reach us. You can find us online at www.ultratherapysolutions.com, and we talk about, what is lymphedema, what are the symptoms, so patients can kind of see the limbs.
So there's some education on there.
There's some education on there too.
Okay, great.
You can contact our office 214-699-1296, and we'll be happy to get you with someone. We have about 40 lymphedema therapists in DFW. So
we utilize you guys too for several of our patients too. So I so appreciate you guys.
We appreciate that.
Yeah, that's awesome. Well, thank you so much for coming. This has been great.
Me. Absolutely.
Awesome. Thank you.